Good evening friends, welcome to the healthcare today. Today we are going to talk about pollution and its effects on lung. What does pollution do on lung? So when we talk about pollution, especially these months, November, December and January, due to increasing pollution, what exactly happens in pollution? The oxygen content in the air goes down and the toxic gases like carbon monoxide, carbon dioxide and nitric oxide, they increase. Once these gases go inside the lung, they affect your primary defense mechanism, making you susceptible for viral and bacterial infections. So apart from lung, what are the other organs which get involved due to pollution? We also see increasing heart attacks, we also see increasing strokes, and we also see some particular organ which is exposed. For example, eyes, skin, all these organs which are in direct contact with pollution, you can see increased skin allergies, increased conjunctivitis. All these things are very commonly seen in pollution. But today we are going to talk about lung. When I talk about lung and pollution effects, it is not limited to people who are unhealthy or who are having existing respiratory diseases. It is also about patients who are healthy, especially individuals who are healthy. You see most of them suffering from viral bouts when there is change of weather and when there is increased pollution. Why this happens? As I told you, there is increase in harmful gases in the air. Apart from that, due to the increased water vapor content, virus stays in the air for longer duration. Once the virus is available for longer duration, it is very easy for a person to catch the viral infection. And also due to extreme cold and increased pollution, most of the individuals do not step out of their house. There is limited physical activity, and in a closed space there are more individuals. There is increased density of population in a closed space, which leads to infection. Why? If one of the family member is suffering from viral infection, all of you stay in a closed space, so thereby the other family members can contract it easily. That is the reason why healthy individuals also get infection and viral bouts during pollution. Apart from healthy individuals, what about the patients who are having existing respiratory diseases like asthma, COPD and ILD? When we talk about lung, we have mainly two types of diseases. One is airway diseases. The examples are asthma and COPD, and the other is the parenchymal disease, which is interstitial lung disease, pneumonia, etc. So you see most of these patients, the airway diseases, who have airway diseases, asthma, COPD, you see their increased need of inhalers. During months of May, June, July, they may require very less inhalers, or they may not require inhaler in case of asthma. But once the weather changes, once there is increased pollution, all these patients require inhaler. Along with inhaler, we also give them supportive therapy like cough syrup, tablets and other therapy which will increase the sputum yield. Once the patient is having secretions and is unable to get it out, so these retained secretions will cause pneumonia, leading to hospitalization and creating a complex nexus of cycle where patient's lung function will go further down. The whole point of giving these medicines, also asking you to consult a doctor before the winter sets in, is to prevent pneumonia. Because once the pneumonia happens, your quality of life is gone, your lung function is going down, and you go to a vicious cycle where you need support to do day-to-day activities as well. You cannot go to the washroom on your own. So all these things can be prevented by prior increasing your medication, visiting your doctor, and also vaccinating yourself. These days we have good vaccines to prevent viral infection. In case of viral infections, we have influenza vaccine. In case of bacterial infections, we have pneumococcal vaccines where they give you significant relief and prevent you from having severe respiratory issues. And also, please take care of your loved ones. Once there is an infection in the family, always segregate the patients who are already having respiratory infections. It is better to isolate them because their immunity is on the lower side. Please shift them to a separate room before they catch an infection. We care about you.